Worldwide, back pain is the single leading cause of disability. It prevents people from engaging in work as well as all of those everyday activities. So today we've invited our expert, Dr. Christopher Miller, in studio with us today to talk about really what causes people to have such chronic neck and back pain. That's really what we're talking about here.
It is, Terry, and people struggle with these issues throughout the year, and holidays, and when there's events, sometimes you notice it more because you're just not able to do those things you want to do. But commonly what we find patients struggling with when they have neck or back pain that just doesn't go away is actually a degenerative condition of the spine that's developing. Many people don't realize, but our spine will rot and decay due to stresses in our lives, and if we don't do healthy habits to keep our spines healthy, but it does rot and decay very similar to maybe tooth decay or gum disease. And some issues that develop would be things like degenerative disc disease, where these discs, which are pads and spacers between the bones, start to dry out and start thinning down. That can start pinching nerves, and they also become very brittle and hard. So when you're trying to move around, it leads to a lot of stiffness and fatigue and pain when those patients are being active. And then on this computer animation, when those degenerated discs are not attended to or corrected, they start to tear, and that can lead to a bulge or a herniation. And this animation shows that blue disc pushing right into that red nerve root. It's a very painful condition, and it can be more than just neck or back pain. Many times that would affect the extremities, like the arms or hands or the legs and the feet.
Yeah, you talk about this, so obviously the pain is the initial thing that we see, but also it can cause numbness or maybe put people at risk for a fall.
And they have lack of coordination and balance on their feet because the nerves in our back go into our legs and feet, and when they're impinged, sometimes that will affect the muscles and the coordination, where they start feeling like their leg's going to give out, or they're just not as steady on their feet because their muscles aren't flexing to hold them up properly. If it's going in the arm or hands, sometimes they'll start dropping mugs or utensils as they're eating, or they might find it's becoming hard to write, like with a pen or a pencil.
Yeah, and we talk often about how when you have pain, you go to a doctor, and oftentimes you're given something to either mask the pain, or you're prescribed something that could make the situation ultimately worse.
It's almost like saying if you had a painful cavity in your tooth, rub some numbing gel on it. It's just not going to get better. You have to fix that problem. And unfortunately, that's the most common treatment recommendations out there for back or neck pain revolve around masking those symptoms. Like you said, it could be muscle relaxants, painkillers, there's anti-inflammatories, there's drugs for the nerves, but these are masking symptoms. Other times when that's not working, they might start going to pain clinics and getting shots in their neck or back, and that's generally an anti-inflammatory steroid called cortisone to reduce inflammation in that area, so hopefully the nerve isn't pinched so bad. But cortisone also can rot our bones and cause osteoporosis, starts affecting blood sugar levels. We've had some patients that become diabetic because of those continuous injections over their life. Then the worst case scenario would be facing neck or back surgery, which is very invasive, and they go in and start clipping bone and cutting material out.
Right, exactly. So let's talk about the DRX 9000. It's a special machine that you have in your office that really allows you to correct the problem.
And that's why it works so well, Terry, is that this is a medical device that actually helps to regenerate those damaged, injured discs and degeneration of the spine. And when you can get your back and your discs healthier, that's where you're going to be able to get out there and live a normal life once again. Patients really enjoy some other facts: that it's not invasive, there's no drugs, no shots, no surgery involved with this, and it's very relaxing. Many of them just take a nap during the treatment because it feels good and they're getting relief as that pressure is coming off the nerves. Also, I develop these programs case by case, but there is a start and finish to these programs. It's not something that they have to do continuously the rest of their lives. And another nice aspect, we know people are busy, so if they need to continue to work as they go through the program, many times they're able to do that, continue to do their chores and things that they have to do each day, driving and that. They don't have to just lay in a bed for weeks to heal.
Exactly, and oftentimes people find relief almost right after that very first treatment that you have. In fact, when when you go into your office, you have so many just testimonials, glowing reports from former patients, like Gary, for example.
Yeah, Gary's a really hardworking guy. He owns and runs an Ace Hardware, and he's got to be active, and his body demands that of him. And he was just at a point coming to our office with severe back pain and leg pain. He just wasn't smiling the way you see here, and he was concerned about his future. He has to run that shop, and the treatments he mentioned here really weren't working. Just worked with Gary on Friday, and his pain's down to a 0. Everybody's commenting like, "What are you doing? You look just so much better."
Right.
He's walking upright.
Yeah, because you can see it in his face. He's just happy because he's relieved from the pain. And how about Cheryl?
Cheryl also had horrible degeneration in her lower back, and being retired, she did want to travel and see the world, and this pain was stopping her from doing that. She had to cancel many trips just because she didn't think she'd be able to walk, or she was concerned she'd hold her family or friends up. And by correcting her problem through our decompression program, she's happy now taking trips and walking the way she wants to walk.
Yeah, okay, so let's talk about a special opportunity for 8 West viewers to at least get that initial consultation.
Yeah, even if your doctor said there's nothing else that can be done, I'd urge you not to give up. Many of our other patients have been told that, but if they call our office today, Terry, for $49, we'll do a consultation and a thorough examination so we can start, confirming what's the actual cause of that pain, why is it not getting better, and then we'll start determining if they do qualify for my decompression program, where they could start getting that problem fixed once and for all.
Yeah, sounds fantastic. Relief could be a great present to yourself as we close out 2019 and head into 2020. Thanks, Dr. Miller.
My pleasure. Thank you.
And stay right there. More of 8 West when we come back. Don't go away.